I hope everybody joins early so that I can discuss a clinical case which I have found very useful. In one of the cases I have seen maybe about 10 days back. This was okay. People are joining. Welcome, Dr. Kanchan Kumar. We are live on both YouTube also and Instagram also. So there was a very interesting case. There was a case of recurrent lot of cough coming out for a lot of time, and the patient did not have any relief. Yeah, welcome, Dr. Anja. This is a case of recurrent cough. An acute case was there, recurrent cough, but this was for the past 3 to 4 months. He said that whenever he used to take some medicine, the cough used to be better. And whenever he used to stop the medicine, the cough started. So he had tried homeopathy, allopathy, all medicines, but it was only a temporary relief. Welcome, Dr. Babel. While taking a case, I took the case, and at the end of it, I told the patient to describe something more which he has not told maybe in other case takings and all. So he had a very, very interesting symptom. He said that I feel as if the chest have been stuck from all the corners, so I cannot move the chest. Stuck. Something is stuck. So when I cough, it moves with force. And this is a very, very important symptom. Of course, then we asked some more symptom, but this was the entry point of the case. Whenever you get this type of symptom, and you feel that the case is not better with a lot of medicine, give importance to this, because this is a sensation which the patient has been feeling, but he thought that this is not useful, this is not related to cough. That's why he's never told anybody. But this symptom was told to me by the patient, so we entered through this symptom. And can anybody guess what was that symptom which I took for the entry point of the case? And we gave us, I think, 2 doses of that remedy, one day morning and one day night, and he was better 80% within 3 days. So these are very, very important entry points, and surprisingly, these entry points basically teach you a lot of things in a practice. Anybody can tell me what symptom which I took for prescription, the interpretation part, and then we can see what remedy I prescribed. Anybody? Okay, so before that, we have a question. So we'll take that question first. Dr. Arora, welcome. Case of apoplexy after spine surgery, after myocardal infarction, after setting stents and clearing the existing bypass apoplexy, paralysis right side, speechless, crying. Crotalis horridus 30 for 3 days, helped well. Then 10 days break after taking it. Yesterday, again Crotalis horridus after and carbohydrates, since big weakness, no drive for itself. There was definitely directly a reaction, immediately more awake, crying stopped. What potency should I continue with LM? Perhaps which one? Yeah, basically, see, if the patient is telling you that he's much better and you are finding a change, and yes, apoplexy after this is Crotalis horridus is given, it is very, very nice that 30 has worked. So when 30 has worked, you can always increase the potency to 200 NC rather than jumping into LM potency. Give 200 potency maybe twice a day for 2 days and see the reaction. If it does not work, then you can think of LM potency, and you can start with LM5 if 200 does not work. But I have a gut feeling that 200 should work. 200 will work. Okay. Welcome, Dr. Sahu, Dr. Punit Rana. Yes. So which symptom I took for prescription, that was basically we are talking about. What do you feel like? Which symptom? Anybody? Of course, then we added some symptoms of that remedy, and the remedy came very easily. Yeah, good morning, Dr. Alexandra. So this was a very important symptom. So we took the symptom for prescription was there is sensation of adhesions in the chest, sensation of adhesions of chest with aching in the bones. And only one remedy comes to our mind, and that is Rustox. Rustox 200, 2 doses, 1 day morning and night, and the patient was 80% better in 3 days. This is how basically sometimes you have to prescribe, because some symptom the patient feels okay. So कभी कभी क्या होता है कि ऐसी पेशेंट्स ऐसे कोई सिम्टम बताते हैं, डॉक्टर मंसूर नोटेड. Sometimes the patient does not tell symptom because he feels that symptom is not related to disease, and I don't know what the doctor would feel, or the doctor would feel that if the patient, how is the patient, he's not learned, that's why he does not tell these type of symptoms. But this adhesion sensation in the chest is such an important symptom, very very important, especially in cases, and this Restox worked wonderfully. Of course, there are other remedies, as I told you. We then added one symptom of influenza with a lot of bony pain the patient had, a lot of cough the patient had, dry cough, and the sensation of adhesion. And Restox 200 worked for the patient. Welcome, Dr. Vansh. Good afternoon, Dr. Bilwalkar. You experience in treating Hallux vulgus. Now, see, whenever condition, can you have some symptoms of that, so that only disease prescriptions I can tell you. See, what happens in this type of condition, there is a bony deformity. Okay, and what happens in this case with medicines I have seen, you have to do some occupational therapy also. See, forefeet deformity is basically, if you see, also called as bunion, that part of the toe comes out, so it is very important to have that caliper or splint wearing, so that the toe goes inside, and cosmetic, it goes inside, and then you can give medicine to strengthen the ligaments and the muscles. But this has to be done at an early age, after 18 or after 16 it is sent, there are only 20% chances of getting that cured. So if the patient has come to you and we have patients with bunion and flat foot, we can only treat the symptomatic pain, but I have never seen in my practice cure of bunion after 20 years. It has gone inside. I've only been able to relieve the pain, but wearing a splint would be very advisable. If you wear a splint, the symptom would be much better. Try to immobilize that part. It started after a fall. Yeah, maybe it started after a fall, so that a bunion is there, but symptomatically the pain would be treated with arnica. But the bunion going inside, I have not seen in my practice. So this is only what I can do. But before 18 years or before 16 years of age, the patient can be totally cured if he wears the caliper with homeopathy medicines, which basically works on the ligaments and the muscle tissues. Like we have Berispur, we have Ruta, we have Symphytum, we have Macphos, we have Rustox. Those remedy would definitely work depending on the symptom similarity. Okay. Welcome, Dr. Motwani. Welcome, Dr. Bawa. I hope this is basically what I have known in my practice. So we were just talking about that part. Yeah. So we were just talking about that part of the chest symptom, which I just told you, that the patient had a sensation of adhesion. Now, whenever you have a sensation of adhesion, now it is important to understand with Restox, there are few remedies that you should think about. That's what I thought about. First, it would be Ranunculus bulbosus, very, very important. Second is Thuja, and third is Plumbum metallicum. Those have given me very, very good results in these type of complaints. So just this patient came to me just 10 days back, and Restox was very clear and very, fresh in my mind. That's why I could tell you the symptom. Apart from the bony pains and all, you had Restox was given. So, yeah, hello, Dr. Jadhav. Can we go have a child's case with myopia, eczema, and some mental symptom followed the remedy? The eczema is much better, but myopia 0.5 worse each eye. Is remedy wrong? See, psychosis is there in both the cases. Welcome, Dr. Sharon. Psychosis is there in both the cases. So you must see if the myopic eye, which the patient suffered from, how is the growth pattern. Was the myopic eye growing very, very fast, and with your medicine the growth pattern has stopped and it is just increasing? So your medicine is able to hold that myopia. I think if the medicine is right, wait for some time or repeat that dose in LM or central potency, and you should get a change. Don't change the remedy. Do you have any experience with treating cyst in liver? Patient has a cyst size of an egg, liver is working normal. Yeah, I have case of cyst in liver. In fact, cyst in liver, hemangioma in liver abscess, these are there, and they have definitely given me good results. So instead of just going by basically cyst, cyst basically it is related to organ. So whenever the cyst is related to organ, make sure that you see, if you take that rubric in generalities, you have 4 or 5 remedies which are very very common, and one remedy which is very common basically is phosphorus. Phosphorus is there, I think graphitis is there, brattacarb is there, calcarea floor is also there. So take some symptom. Sometimes the benign cyst there are no symptoms, but there has to be some symptom basically which will decide the remedy. So you go in generalities and see that symptom in general condition. Don't only be confined to the liver cyst. In those cases, then you will get some other remedies, like we have thuja also, we have medoronum also, we have hiparsulfan, calibacrom also. But 3 4 remedies which are very common, that is phosphorus, graphitis, calcarea, and brattacarb. Male 57, pain in left hand and some numbness in left leg, heartbeat high. Pneumonia was in COVID-23 HRCT at time, giving T Arjuna and especially Aura gold drops. No, I don't know about the Aura gold drops. Arjuna you can give, it is absolutely fine. But you have the patient, see, heartbeats are high. Now, basically, if you see the Arjuna, relation to Arjuna, it is basically more related to conditions where there is blockage in the heart. Now, you have cases where the pulse is high, see, most important thing is after COVID. So you have to take after COVID, if the disease basically has gone from the COVID infection to the heart infection. Which symptom you must take for prescription? Anybody? What are the other symptoms? Anybody? Anybody? We have a case where the patient is suffering from COVID, and after COVID is okay, he suffers from heart problem or beats are high as such, the patient as this. There is a very very important symptom. If you have seen the repertory, there is a fantastic rubric. Anybody can answer this question? There is a fantastic rubric where it is written that metastasis. Disease has traveled. In homeopathy, metastasis means the disease has traveled from one system to other system, one organ to other organ. So you must take that into account also, And then if you try to see, only prescribing Arjuna, I don't think would solve the case. Temporarily it might, but this rubric is very important, and this rubric in COVID scenario is very important because people had a lot of symptom apart after COVID. So you can say that pulse accelerated and metastasis after COVID. There are 3 4 remedies that you should think about. First is arsenic album, second is Naxomica, third is Abrotenum, fourth is digitalis, and the fifth is Carboveg. Do think about these remedies, Dr. Arora. Yeah. So one question in Instagram has scrolled up. If you can write again, it will be better. And see, if you are only treating for pulse, high pulse, there are so many remedies, But make sure if you only want to treat with these complaints, then the type of pulse is very important. How is the pulse? It is bounding, it is high. There are a lot of other symptoms, in pulse, irregular pulse, rapid pulse, fast pulse. If you see those symptoms and combine that, so there are 3 4 remedies apart from which I told you is arsenic is there, Naxomica is there, Carboveg is there, but belladonna would be very important. Phosphorus would be important, aconite, and the fourth remedy would be veratrum viridi also is important. Then you have to look out pulse when it is more in the morning, in the evening and night, or more in the after eating, before eating, or doing exercise, or during rest. So then basically try to identify some symptoms, and then if you go basically to the remedy, it would be better. There are pulses. It is written that pulse rapid more than the heartbeat. I had a case where the pulse was more than the heartbeat. Then you have 2 or 3 remedies very very important. The first is Spigelia and the second is digitalis. So if you don't want to go with that rubric, just define the symptoms of pulse, and then also you can be able to prescribe the remedy. Okay, and then left side and numbness you add to that. Okay, Arjuna, it's a benign remedy you can give. It is called heart tonic. You can definitely give, but it would not cure. It would maybe suppress or treat only symptomatically, but the symptom will come back again. I hope I am clear with the symptom and the respiratory part of corona. Next, in fact, If I have no questions, so I can go further. Yes. Anybody having experience of using that rubric metastasis, where a patient had COVID and now he develops some other system. He had liver problems, he had cholesterol, he had heart blocks, he had diabetes, he had a lot of other symptoms after COVID. So it was suppressed with allopathy medicines. So did anyone have that experience of using that rubric metastasis in this type of complaints? Anybody, and with good results? No? So let us go further. I think nobody has that. Uh, so if you don't have, I'll tell you some of the remedies which you should use for metastasis. First of all, generally, if you see when there is metastasis, only don't think only of cancer, metastasis, but in homeopathy, it has some other meaning also, applied meaning. You must think of a very, very interesting, a very, very important remedy, that is abrotenum. That I have told lots in my seminars, abrotenum. The second remedy that everybody should know is carboveg. The third remedy that everybody should know is pulsatilla, lachesis, and sinusoides. These are very, very important remedies where the disease has metastasis from one organ to other organ, from one system to other system. And sometimes, we just take the other symptoms of the disease process and fail to understand the metastasis rubric. If you understand that rubric, you'll be able to prescribe it better. I hope you're understanding. Okay. Good afternoon, Dr. Amit. Pain in lungs. Yeah. I was only thinking to use the rubric in cancer. No, don't use. There are other indications also. Yes, abrotenum, Dr. Bawa. That is why I love to be here to learn. Yeah, thank you so much. And I also love to teach, because before COVID, I was not such an, what do you call it, taking seminars, and I was more important basically only in treating patients. After COVID times, I started webinar and I thought that this is quite common, and sometimes it is not. And a lot of people, WhatsApp me that, why did you start early? But I love to share the knowledge because the petri grows. That's the important. Choice of remedy for rheumatic patient, male 32, had no swelling in joints but only stiffness in all joints with insect moving sensation in the body. See, insect moving sensation, if we have been treating these type of cases, and there'll be a lot of cases with this sensation. And I have failed while using this sensation in many of cases. In your case, something is very, 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 very particular, that stiffness. Now, simple as that. Stiffness basically in arthritis is normal. If you read rheumatoid arthritis, if you take this symptom, it would be quite common to prescribe. But your patient basically is telling us that the body is stiff, that symptom of arthritis. In this case, do think about some other symptom also, because if you take stiffness in all joints, there are so many remedies, so many remedies like we have simple remedies of causticum, rustox, silicia, ledampa, lycopodium, or we have remedies like chelidonium, arsenic, asafoetida, and zinc metallicum also. Then you have to identify stiffness in all joints, but more left or more right, more in the morning, more in the evening, more in the right, and then stiffness more after exertion or more after mental trauma, a lot of other symptoms. So these remedies basically I have used in my practice very frequently. Try those remedies, but still try to take a better symptom and better case, so that, see, arthritis is an autoimmune disorder. Treating it would be basically giving life to the patient and the family members also. So in this case, do take the whole case. Okay. Metastasis rubric and tuberculinum. Yeah, metastasis rubric is there, and I have used that in a lot of. And tuberculum, yeah, if you open that rubric, if you open it, metastasis, tuberculum would be there, but I have never used tuberculum in this complaint, because tuberculum is only, I think, 1 mark in that. I have not used. What I've used, I have told you, okay, in my practice, or most of them I used. I have told you that. Abrotenum, yes, Dr. Bawa. And I hope Dr. Bawa, your mother recovers quickly. I've already sent the medicines, okay. Sir, I had spoken last YouTube, liver about 90% ligament tear. It gave very good results, recovering very well. I have started Calcareca LM3. 50 days are fantastic and very nice, Dr. Amit. And thank you for sharing the experience. and giving me also boost that whatever I'm teaching is helping you all, and my knowledge of mathematics and homeopathy is also somewhat good, so that you are able to understand and prescribe in your practice. Thank you so much for sharing, and everybody learns that Dr. Amit had a case. She's recovering with calcarea carb LM3 TDS for the first 15 days, now shifted to LM4. Fantastic. Repetition of potency, Dr. Amit, depends upon the susceptibility of the patient and how the body reacts. Okay, there's no fixed loss. So watch the case carefully. I think by LM5 or LM6, you should be able to taper it down to, I think, once in 2 days or once in 3 days. Fantastic. Very nice, Dr. Amit. That gives me a lot of boost. Whenever I'm taking a seminar and people say that, sir, with your medicine it worked, so it makes me feel very happy. Tomorrow also I have a seminar on migraine. Migraine. I have an Instagram live. Somebody's taking that seminar, and I'll share you the link. So I'll be speaking on migraine. Do attend that Instagram live, because as I have started migraine clinic, I have fantastic results. And I was surprised that migraine sometimes of 15 years duration, 20 years duration. I had a case of migraine, 40 years duration. One dose of ferrum metallicum cured that case. One dose of ferrum metallicum. Fantastic. So do hear that case, that lecture on migraine. Okay. Yeah, Dr. Vansh, thank you. Thank you. Yes, sir. Thank you. I want to know that, can I give second dose of blood 200 to mommy today? She's better now. If she's better, Dr. Nojo, don't repeat the medicine. Wait. See, medicines basically are like, it is like Sanjeevani Booty. Every dose you give to the patient is like giving life to the patient. So with the one dose of belladonna, if life has come back, wait. Don't waste your medicine, don't waste it. Wait for that. Any guidance in treating parathyroid adenoma? Any approach? Yeah, see, parathyroid adenoma, I have few cases. If you treat only the disease condition parathyroid adenoma, you will not be able to treat that. Understand the case through miasms, psychotic miasm. Why did the patient land up in psychotic miasm? How did Sora gradually went into psychotic miasm? Learn from the mind of the patient, and you'll be able to prescribe it better, rather than just prescribing calcarea floor and phytolica and conium. It may or may not work. But when you go through miasms, I've seen fantastic. I had a case, of thyroglossal cyst, thyroglossal cyst. And the doctor told to that patient, don't take a chance, operate it, because if something happens, it would hurt the vocal cord and the recurrent laryngeal nerve. I took the whole case, prescribed the remedy, and the patient is cured. The patient is totally cured. The report before and after sonography, both I have, it is totally cured. Miasms, it is important. So go through miasm, Dr. Vanch, and I think you should be able to cure that case. Remember, approach of a case, whoever is teaching you, I don't know, but Hahnemann approach, the miasmatic approach is the best. That's what I have seen, and by the grace of God, have a good results with that approach. Cured a lot of cases of brain tumors or CAD or CRF, adenoids, adenomas and all with that approach only. Miasmatic approach is important. Retracted nipples from birth, it is syphilitic miasm. See, retracted nipples from birth. If you basically, if you want to know the miasm, first of all, you have to know whether you want to treat that condition. If you know the miasm, it's okay, but are you treating that condition? That is important. And second, what does that retracted nipple indicate at birth? Automatically, I've seen in many cases, automatically the growth pattern, the nipples becomes normal. Irritated nipple, I think, would be more interested if you are treating a case of breast cancer rather than just knowing the miasm, so there's no need to treat that. Unless the patient is showing some symptom. See, if you have read the books of medicine, it is written that a retracted nipple can be a normal variation of a nipple type. So then you have to judge by what the patient basically is suffering from. Sure, so my patient is relapsing. I'll go through miasm 2 years. Baking nation joint. Okay. Can explain the acute smell in syphilitic. Yeah, see, acute smell, if I'm sitting here and I can smell 2 rooms ahead, what is the smell coming from the kitchen? That means my smell is out of control. It is syphilitic, no? There are some cases who come to our OPD and he said, I had a case where he said that my child has a fantastic memory. You just name the day, you just tell the date, he'll tell you the day. So I told 24th September 1950. He said, sir, it is Monday or Tuesday. So it is out of control memory. That is also syphilitic. So that case was suffering from hyperactive disorder, and this was a syphilitic symptom. So whenever anything is out of control, whether it is smell, taste, taste, anything, it becomes syphilitic. So that's why I say acuteness of smell. A patient says in fever everything is okay, but I can smell something is cooking in my kitchen, and that is important. And that's why it becomes a very important prescribing symptom. Okay, I think this question was asked somewhere before also, I don't know. And acute and smell, there are a lot of remedy. Okay. Yes, so Dr. Alexander, I hope you got that. Sir, a lady aged 40 years approached for pace of ACL surgery was to cure for. Sir, she has pain in knee and cramps in calf. How to approach? Post ACL surgery. Want to cure home. Now, cramps in calves. I don't know whether that ACL surgery is related to cramps. I can't tell you, no? Because see, normally ACL surgery is only related to, and it the surgery being not happening properly or something happened. I don't know. It might cure cramps. So if the patient has got cramps post surgery, just take that acute case and give. How is the cramp? How is that muscle being very tight like a stone, or tight only in the night? Take it symptomatically, automatically you will get the result. Okay. But if you still feel, then you must think of remedies after operation, like Staphysagrine is there, Ledempal is there. But I doubt that ACL ligament would have a problem in surgery, unless the surgeon has done a blunder, that's okay. Yash Gupta. Can you please explain why? So ever is out of control. Thank you so much. Okay. See, I'm. If it's very important to understand that whenever somebody is talking in a webinar, at least go to the doctor's OPD and see how the doctor practicing. So I welcome everybody. Come and see the practice, and you will understand how to interpret a symptom. That is very important, Homeopathy. Interpretation. If you are able to interpret that symptom, what the patient is telling you, automatically, your practice grows very well. If your whole case is taken for 1 hour, 2 hours, 3 hours, but if you are not able to interpret that case properly, how will you prescribe? The basic interpretation, timidity and lack, weeping tendency, consolation, amelioration, desire, traveling, thirsty, chilly. These all are basic soric interpretation. If you prescribe on those, polycrest comes and you feel the remedy is not working. But the interpretation in syphilitic miasm is very, very important. If you are able to interpret a case properly, you can definitely make a huge difference in your practice. So interpretation is very important. Try to interpret symptoms and try to keep reading your mathematics and repeat so that your approach is same, miasmatic approach, so that your results also increase in number. I hope, Dr. Babel, you have got the answer for your syphilitic miasm. Sometimes it is a normal variation in birth. Unless there is something more syphilitic in that case, then you have to take that rubric. Something Instagram, there are some questions scrolled up. If you could write, it's okay. Otherwise, we're already in the last minute of our live, but it goes very fast. Acuteness of smell, acuteness of smell. When the stool is very hard like goat pellet, the rubric is balls, or is there any better one? No, it's balls only. It's that's the same rubric I take basically, or you can take like sheep's dung. Sheep's dung also you can take the stools like sheep's dung. You have that, but sheep's dung stool is there and there are a lot of remedies, but instead of taking that, you understand the pathology, the physiology also behind. So that would be also important in these type of cases, sheep's dung stools. There are stools where you can take round balls, but sheep's dung should be good. Stools like sheep's dung, then opium, plumbum, sulfur, mercury, maca, alumina are there, but then you have to see why. whether it is inactivity problem, peristalsis problem, tonicity problem, lot of other things are there, stool of Shri. It is not my case the patient has breast cancer and the nipples. Yeah, that is important, Dr. Babel. In breast cancer, the detected nipples are very, very important. Very, very important. It is not mentioned in book of medicine that retracted nipple could give rise to cancer in future. So take that as a normal variation of nipple, but cancer case would be interesting to treat. So if it's not your case, make sure that you are follow up with that case and get some good results. So I hope everybody has today good results of Kalkerak. I'm very happy that the results came. That's nice. Yes, she has to squat in toilet, and now she has. Now see, then you have to think in, rather than taking this, you take a rubric, where we have constipation in children's. There are constipation in children, or you can say constipation in newborn. If you take constipation in children, there are very, very fantastic. The first remedy that you have 5 Ds, but podophyllum is a very, very remedy for children's constipation also. And then you have to take especially bottle feed babies with artificial bottle feed. Then podophyllum is more important. Okay. So yeah, I hope everybody enjoyed it today, as I enjoyed teaching you the knowledge. Until next time, meet you on next Saturday. Thank you.